Good evening, everybody. My name's Mike Bell. I'm chair of Croydon Health Services, it's my joy to welcome you to our AGM tonight. Apologies for the slightly late start. We've had a few technical issues. I shall be coming on video very shortly. Now I am here with you. But we think we've got them resolved, and we'll move straight on into the meeting. As you'll imagine, this has been another dramatic year for our lives in Croydon, and no more so than within Croydon Health Services, which has been right at the heart of the community's response to COVID-19. I would like to kick off with a few thank yous. First of all, to my board colleagues for their sterling efforts throughout the year in terms of keeping the show on the road through very, very difficult challenges. I'd also like to thank our partners, particularly in the council, third sector, and across primary care. Without them, the response within Croydon, I know, would not have been anywhere near as effective as it has been. And I'd also like to thank my colleague Agnello, was co-chair of Croydon Health Board, and his colleagues from the Borough Committee of the South West London CCG, who have worked with us tirelessly in terms of our response to the crisis, but our future planning for the improvements of Croydon health and care system. If I could move on to the next slide, please. The thank yous don't stop there. Right at the heart of our thank yous is a big, big thank you to our team in Croydon. The staff have been absolutely amazing, demonstrating their strength, their courage, and I think above all else, their kindness during this really, really challenging year. I think that we celebrate their achievement in saving lives, in comforting people who have been bereaved by COVID, and often in very, very difficult circumstances, often having to care for relatives remotely. The crisis has continued, and they have worked tirelessly throughout the last 20 months. You'll hear many, many more of their stories as we proceed through our annual general meeting tonight. I want to tell you a little bit about an exhibition which is currently at Croydon's Box Park, which tells the personal stories of many of our staff. Definitely worth a visit to the exhibition, and it's on until the end of this month. So please do make time to go there and see that. If we could move on to the next slide. So whilst we've all talked about COVID during the past year, our story and our year hasn't just been about COVID. There's a few things I'd be keen to share with you, and we'll talk about many, many more of those in the course of this evening. The first, of course, is the work that we've done on vaccinations across the system. The very, very first Londoner was vaccinated in Croydon to protect against COVID-19, and the hub at the hospital site has continued to be incredibly busy. We've had our primary care colleagues, GPs in particular, have been absolutely instrumental in delivering the COVID challenge across Croydon. We've also had pop-up clinics in different community pharmacies, and we've had a number of COVID hubs. And I want to thank personally Matthew Kershaw, our Chief Executive and Place-Based Leader for Health, who's acted as the Senior Responsible Officer for Vaccinations across South West London, and has done so much to make sure that we've reached all parts of our community in Croydon. A couple of other highlights I just wanted to bring to your attention. When I joined the Trust way back in 2013, we had the very, very worst staff survey results in the country. We've steadily improved over the years, but last year we had the very best results that we've ever had in a staff survey, and that's really fantastic at a time when our staff have been so challenged by COVID. So a big thank you to all who've been involved in making sure that we get the welfare for our staff right. Another area that I'm absolutely keen to talk about is the work that we've done in re-establishing our planned care, all of those operations that we hear so much about in terms of extended waiting lists. Croydon Elective Centre, a hospital within a hospital, is a blueprint for how things can be done across the country, and it's been taken forward by other trusts elsewhere. Croydon continues to be amongst the very, very best performers in recovering from COVID in terms of planned care. And I want to say a little bit about our work in the community. We've opened the community hub in Thornton Heath last year, and we've opened virtual community hubs across Croydon, which bring together all of the services that people need around their health and care and well-being, and are making a real difference in people's lives. We'll also be focusing a little bit about the future, and I wanted to say a little bit about some of the investments that we've got coming on stream during the course of the year. We've secured nearly £15 million for our new intensive care unit, which will double the capacity we have for intensive care in Croydon, which means that we can treat more of our people closer to home. And we've started work on a brand new £5 million hospital for children within the trust, bringing care closer to home for some of our borough's sickest children. This is being recognised nationally, which is fantastic news for us. I'm so proud that in 2021, we've been shortlisted for the Acute Trust of the Year by the prestigious Health Service Journal Awards. It's a real recognition of the work that the team Croydon have done in terms of improving our care and delivering the services our population need. It doesn't mean that we've got it all right yet. We're continuing to need to improve everything as we go along, but it's a good marker of the success so far. But I get the exciting part of the meeting. I get to do the formal bit of the business, and we're going to move on to the Agm Proper, which includes 3 items. The first of these is the formal acceptance of the minutes, and these have been circulated previously, 7 pages of gripping read. I am assuming that everybody is content for us to accept those minutes. I'll check that there's no hands going up to object, in which case I accept the minutes of we accept the minutes of the last AGM. The next item on the agenda is the approval of the annual report and the accounts. The annual report actually is a gripping read, unlike the minutes of the last AGM. So I would commend that to anybody to get a sense of what we've achieved in Croydon as a trust and with our partners. The accounts again demonstrate that the trust and the health system in Croydon is getting close to being on firm financial ground. And that again is a huge turnaround from previous years. We'll be hearing a little bit more from Mike Sexton later on today, telling us a little bit about how we create a financially sustainable system into the future. But I am hoping that people will be content to approve the annual report and the accounts. And again, I will look for hands going up for items of dissent, but I can't see any. I can see thumbs up instead. So thank you for that. We'll approve those areas. And finally, on to the trust quality account. And this is a really important document which sets out the ways in which we've improved services over the last year, and also identifies very honestly the challenge areas which we continue to work on. Again, this is a formal document, and I'm asking for approval from my colleagues, and we'll look for any dissent, no dissent, thumbs up. Thank you very much. That is the formal business of the AGM, which I'm sure is the highlight of everybody's year. We're now going to move on to the real highlights of the year, and I'm going to ask Matthew to kick off the review of the year. We'll hear from a whole range of colleagues as we move forward. Matthew, over to you.
Thank you very much, Mike, and also for getting us through that business. As you say, we're now going to go through a review of the year, some other highlights and some of the work that we've done. I'm starting off, but you'll be pleased to know that we have a whole range of people commenting and contributing during this section of the meeting. So without further ado, I will start us off. And the thing I wanted to say first and foremost is whilst it has been a very challenging year, one that I think we can be very proud of. That's not to say everything has worked exactly as we'd want it to. That's never the case, but I think there is lots to be positive and lots to be proud of. And at the bottom of that, underpinning everything, is the contribution that our staff have made. None of what we've done would be possible without the staff working so amazingly hard and well during what has been unprecedented times. A much overused word, I appreciate, but I think wholly appropriate in the circumstances that we have been working within. And I would reinforce the point that Mike made, that today is about the Croydon Health Services AGM, and therefore a lot of this will sound like it's just about CHS. None of what we do can be done without the contribution and support and partnership working that we have in Croydon, whether that be in primary care, in mental health, with the voluntary sector, with a local authority. We are well blessed in Croydon to work well collectively, and that has been demonstrated this year and the last year more than most. So I think that is important to say, despite the fact that tonight is about CHS as an organisation. The recognition that we've had from people for the staff has been hugely well received, whether that be the visit by Her Royal Highness Princess Anne to see our maternity team, or indeed the support that we've had from the local community in many, many different ways. We've also worked hard organisationally to say thank you to staff. One of the ways that we've done that, we've talked about it in previous years, is about first response. That had its 1-year anniversary in the last 12 months. It's a great initiative, thanks to Elaine and team for developing that, where we as an executive team, supported by other senior colleagues, go out once a week to say thank you to staff by offering them a tea, a coffee, a cake, some fruit, and a chat about things that are going on the wards and in departments right across our organisation, both in the community and in the acute trust. So I think the fact that we've kept that going, maintained that, demonstrates the sort of commitment that we've got to support our staff, and I think that is extremely important. Their well-being is fundamental. If we don't look after our staff, they can't look after the patients in the best way possible. And so things such as the Wellbeing Week, which we held to boost the morale and help staff think about both their mental and physical well-being, and to say thank you, I think is a good demonstration of that. If I could move to the next slide, it talks about listening to our staff. And as Mike's already alluded to, the staff survey results in 2020 gave us some positives about what we are doing well. Increases in the percentage of people recommending the trust as a place both to work and to be cared for, and a significant spike up in the recognition of ourselves taking action on the health and well-being of our staff, as I've just described. So we were very positive about that, but we're also very honest that it is still a work in progress. There is plenty of areas where we know we have more work to do, and we are absolutely committed to doing so. We're just about to go into this year's staff survey, so we'll see some of the work that we've set in train to try and make the organisation more inclusive, to support people more if they feel that they may have experienced bullying or harassment in their jobs, or to continue that focus on health and well-being. We'll see whether or not what we've done over the last 12 months has paid off when people reflect on that in the survey that is just now going out to staff. So we are pleased about the positive progress. We can see it and we can feel it and we can hear it from people when they talk to us, but we're also clear that there is plenty more work for us to do. It is areas such as those I've described where further improvement focus is required, and we are committed to absolutely doing so. If we could just move on to the next slide. One of the key things, I think one of the positive aspects of working in Croydon, and something that we definitely are proud of and want to cherish is the diversity that we work within here in the borough. And more than half of our staff, our family, come from Black and minority ethnic groups, and that absolutely reflects the communities that we serve. And so initiatives such as Black History Month, where we made, I think, a real step up in the scale of the celebration that we led for Black History Month, and will be doing so again coming up in a few weeks' time. We've also spent time developing staff networks to try to reflect the diversity of the staff who work for us, whether that be in the Women's Network, the Religious and Beliefs Network, the Ability Network, or the LGBTQ+ network. All of those have a really, really important part to play in giving staff a forum to discuss, to raise issues, to celebrate, to come together and to network and support each other. And that's a really, really important part of how we are trying to address the ongoing challenge, but also opportunity that the diversity in our borough and in our staff brings us. So that's just a bit of a focus initially in the review of the year around staff. I make absolutely no apologies for starting with that, because without that we have nothing. Neil is going to now take us through some of the headlines around performance, and then we'll carry on with the review of the year with other colleagues coming in, and I'll be back to speak to you all in a short while. So, Neil.
Thank you very much, Matthew. I'm Neil Goldberg. I am Director of Strategy, Planning and Performance, and it's performance that I'm going to be talking about very briefly now. So the first thing I'd say is that outside of COVID-19 deaths, our hospital mortality rates have been within expected normal range, and that's a really important thing, I think, for us, because we keep a very close track of that, and really important for the public to know and be aware of. I won't go through all of the pieces of data on here, but I'll just summarize them in two groups. So first of all, emergency care. It won't be a surprise to anybody to know that emergency care over the course of the year has been very challenging, especially because of COVID, of course. And so in the early part of 2020, our performance, so waiting times particularly for emergency care, length of stay and other measures like that, of course, became worse than they had been before because of the unprecedented demand for emergency care. But they then started to improve over the course of last summer, and for 3 months we had some of the best emergency waiting times that we've had for 7 years. As we then went into the winter again, of course, we had another wave of COVID, and some of those pressures started up again. So that's a pattern I think that certainly all of us within the health service would recognise, and patients and the public, I think, would also understand. The second big area of care, of course, is planned care. So across areas like diagnostics, cancer care, outpatient appointments, and planned operations and procedures, again, it was a similar, those things all had a similar story, which was that when we were in very intense waves of COVID, particularly at the start of the year that's in question, our waiting times went up, as they did around the country. We did manage to maintain more planned care than many other providers around the country. And so what we found was that our waiting times and waiting lists didn't grow as much as they did in many other areas. And what you see if you look at the data is that from the summer last year, we then started to recover really quite rapidly, and managed to maintain a relatively high level of planned care despite a further wave of COVID last winter. And you'll see that we ended the year really starting to get back to what we would regard as acceptable waiting times and acceptable waiting lists. One thing I think that we should be really proud of in Croydon is that CHS has been really exemplary in providing planned care despite the challenges of COVID, although we fully recognise that for many patients, waiting times were longer than we would have wanted, but we're doing everything we can to address that. And so I will hand over now, after that, to Elaine. Thank you.
Thank you, Neil. Good evening. I'm Elaine Clancy. I am the Chief Nurse and Director of Infection Prevention and Control, and I have been the Senior Executive Responsible Officer for our COVID response. COVID-19 has made this the most challenging of my 32-year career by far, but never have I been more proud to wear an NHS badge, to work for the NHS, and to work with some amazing staff here in Croydon in terms of our response. The pandemic has affected all of our lives in different ways, but I'm certain our staff have gone above and beyond to care for our community in the best way that they can. We were doing some fantastic things prior to COVID-19, and we were well on our way to addressing some of the issues that we faced. But the pandemic halted some of that work as we focused our attention on responding to the pandemic. And as we've responded and indeed worked towards our recovery programme with the implementation of the vaccine, as Mike has already said, we were so proud to be the first in London to administer the vaccine, and some of the great strides we've done in getting our services back on track for the local community. We were, moved ahead of slide, sorry. Croydon was one of the hardest hit boroughs in the capital and in the country. There were over 1 million cases in London, and a significant number of those were in the borough of Croydon. In the hospital, we had over 3,000 people with COVID. We've treated 2,000 of those who have successfully treated and been discharged home. Sadly, we've lost 647 patients, and our thoughts continue to be with the families affected by those sad deaths and this pandemic. Throughout each of the waves, we've had to adapt to the challenges to maintain the best care for our patients and to support our staff in both their day jobs and their emotional, physical and well-being as well. We've introduced vital changes to services at key points to make sure that we could push forward with tackling the virus at even the most difficult of times. Next slide, please. But because of our relationships as a system, we had a system-wide response to the pandemic. It's seen as joining up our care and supporting each other more than ever to help people in Croydon live and stay well. By working side by side with our local GPs and care workers, our mental health services, the voluntary sector, all of those working together, local authority, as well as South West London CCG, managed to work together and streamline our response to the pandemic. We would continue to be able to support people to have their weekly GP sessions. We could support the care home staff in terms of their infection prevention control, as well as offering the staff the vaccine. We could support the care homes in Croydon with PPE and the use of telemedicine. So telemedicine systems keeping patients in their own home while we could monitor them with fantastic technology to keep people safe and mean that they didn't have to come into hospital to be cared for. Next slide, please. It goes without saying that infection control was of absolute paramount importance, and I am so proud of our infection prevention control team who have gone above and beyond in terms of their education, their support, their expertise, not just within the acute hospital, but across Croydon as a system with our care homes and GP practices. As well as here in the hospital, we had some of the lowest numbers of hospital-acquired COVID in London. That's because of the work that we did as an infection prevention control team, working with our operational managers and clinical leaders across the organisation. as well as COVID, we also saw a reduction in the number of hospital-acquired flu cases, our colonisations, and our MRSA bacteremias, as well as responding to COVID pandemic. And indeed, we do weekly audits in terms of testing for COVID with our patients who are in hospital to maintain the safety of patients. And we, in our last audit, had 97% in our targets. So that proves that we are working hard and diligently in terms of infection and prevention control. I'm going to hand over now to Hadia, who is going to share a very personal story about COVID.
Good afternoon, everyone. Many thanks for offering me to speak to my Croydon family at Agm today about COVID experience from a personal and also from a junior doctor perspective. A bit about myself. I'm a Pakistani British, graduated from a medical school in Pakistan and moved to UK in 2005 and working in our very own Croydon hospital for about 7 years now. So I've been looking after COVID positive patients since we had our very first COVID admissions in the hospital. I clearly remember those initial days when there was uncertainty, fear of the unknown, worries of being infected, taking the virus home, giving it to our family, vulnerable relatives or colleagues. Very quickly, as we all know, it escalated to a proper pandemic. And the next thing I remember that, we were all being trained of proper PPE usage, which masks to use, donning, doffing, new resuscitation protocols, learning to operate NIV machines, repeatedly and drastically changing infection control guidelines to keep us, our patients, safe. There was lots to learn. And I must say it was an overwhelming learning experience to learn so much in such short space of time on the job. The unprecedented circumstances mounted with national PPE shortages, mixed messages about, level of protection that we should be wearing to keep ourselves, our patients safe, and rapidly changing government guidelines. They were all there, not helping the situation. Within a couple of days, we had a ward, and then in a few days, we had many wards full of COVID patients. I've got clear recollection of my first few patients who rapidly deteriorated and died of COVID. If it was not for COVID, they would have lived for many more years. There was unfortunately so little that we were able to offer them at that time in terms of a targeted COVID treatment. We just focused on making the inevitable easier for them, made sure their families were kept updated, and they got best of whatever little we had to offer. A lot of them dying without their families being able to visit. And sometimes the deteriorations were so fast, there was not even enough time to prepare the families. Soon after, we were provided with iPads so families can see their loved ones. Not always it was a sight that, they would have wished for their loved ones. Seeing their relatives flushed with raging temperatures, gasping for air. It was frightening to hear that my colleagues and other frontline workers dying or becoming very unwell with COVID-19. Every single day, we were all, and I was, fearful of taking the virus back home to me and to my family. It eased off a little as summer arrived, but the misery and sickness was not over. We were seeing extremely complicated, deteriorated patients with various health problems who just stayed away from the hospital due to risk of catching COVID-19. And with the blink of an eye, we were in the second wave. We began feeling a bit more confident this time because we thought we knew a bit more about the virus now. We had known of some medication now that we could give to try to combat with the virus. We had a bit more clear idea of our PPEs and the infection control guidelines. And while we were inundated, again, with critically unwell patients in the second wave, back home, my younger brother and then my dad caught COVID-19, one after the other, and deteriorated in days, requiring non-invasive and then invasive ventilatory support. In that part of the world, the healthcare is generally private, but the private sector closed its door to COVID-positive patients as pandemic hit. And that brought all the stress on an already stretched, understaffed, poorly resourced government health sector. This further took a toll on me because not only I was having to think about my patients, my family, my colleagues, but now I had added stress of my brother and father back home. In that part of the world, there was a huge lack of facilities, serious problems with oxygen demand and supply, lack of an IV machine, lack of trained staff. Most of the days, there were 2 nurses looking after a 32-bedded ITU of ventilated patients, and whereby in this part of the world, we were discouraging relatives to visit the hospitals. The hospital staff back in Pakistan were pleading relatives to be in the hospital day and night to help the staff support looking after their patients. The remote virtual sites of my other family members physically being in the hospital day and night, helping medics to look after my dad and brother, assisting with personal care, checking vital signs, feeding where possible, and having sleepless nights or dozing in the chairs around the bed in the corridors, exposed to the deadly virus, was dreadful. We had the responsible of paying, sourcing our own medications, taking blood samples to private labs for processing, getting scans done privately, paying for specialist inputs where needed. My brother fought it off. He got better after 21 days of ITU admission, but my dad just could not fight the battle. With the poor health system, the virus, the undertrained medical professionals. I was on call here the night my dad passed away. I think he had a heart attack while he was on ventilator. And despite trying my best, I could not get a blood test or a heart scan done for him. So at least I could have a bit more precise account of events leading to his death. I've always valued our national health system, but apart from all the emotions that I perhaps experienced for the first time in my life during COVID, the other thing that I realized was how blessed and privileged we are to have our NHS. I made a promise to myself that I would do all I can to help the people of Croydon and those I come in contact with. If I could not hold my dad's hand, there are many others who would need a loving human touch during the last hours of their lives. I could not do anything to help my dad, but there are many others who I can help to heal. I know all of us have got similar stories to tell. We are in it together and we'll continue fighting it off. I can see ourselves coming out of it, connected and stronger more than ever. I would also like to take this opportunity to stress the importance of vaccination. While we are seeing less and less hospitalizations of vaccinated people, while unvaccinated people are still facing extremes of the disease, I just wanted to use this forum to plead to anyone who have not yet vaccinated to do so promptly. I'm fortunate myself to survive after contracting COVID-19. I would not wish this virus on my worst enemy. It was ghastly and horrendous. If there are people who are choosing to remain unvaccinated, please note that they're putting themselves, their family, and their dedicated, compassionate, and caring health system at a very high risk. I do hope that my short talk gives you an insight of healthcare professionals' experience of this pandemic so far. Thank you very much.
Javier, thank you very much for that. I would just like to say amazing words, huge thanks for sharing your story. Not easy to do. I think you did it with amazing poise and grace and honesty, and I think it is absolutely the sort of thing that we need to listen to and reflect on at the AGM and going forward. And Hadia, I think the commitment that you've made to the population here in Croydon in the way that you have for the reasons that you had is phenomenal. So thank you very much for the work that you do, for the way that you do it, and also for sharing your story this evening. It does demonstrate the harsh realities of what's happened over the last year. It's affected millions upon millions of people, and sometimes you can forget what that actually means. And it's stories like yours, Hadia, both in terms of your family and also what you've seen in your professional life. It's stories like that that realise what this has all been about and why it's been so difficult, but why we should be so proud both of the NHS, the care service, and indeed each individual member of staff who's worked so hard to do their bit during this period. So Hadia, thank you very much indeed.
Thank you, Matthew.
We're going to move on now with the remainder of the presentation, and I'm just next up going to briefly introduce the use of new technology to respond to some of the challenges that the year has brought us. I'm only doing this briefly because we've actually got somebody who's an expert in this, who knows what they're actually talking about, and that's Francesca Domain, who is going to talk to us about telehealth shortly. I'm doing this bit because it's not just telehealth. There's a whole range of things that we've done with new technology over the last 12 months within the trust, and indeed more so across the system in Croydon as well. The one that I would pick out off this slide is the Roche boards, which is one of our consultants in our chest clinic developed with his team a live dashboard which allowed us to organise the care and place patients in the best and safest environment for themselves within the hospital when we were at the peak of COVID, and that allowed us to one of the elements that allowed us to minimise the spread of infection within the hospital, and we're indebted to Roche and the team for the work that they did. And it's a great example of how we can use technology to make a difference. Francesca is going to talk about telehealth, which I've also tested. I was an early guinea pig on the telehealth system. I'm still here, so I think that is a positive sign for telehealth. But Francesca, I'll pass over to you to now talk us through the work that you have been helping to lead for us.
Thank you, Matthew. So I'm Francesca. I'm now the Darcy Fellow for the virtual wards in Croydon, and obviously my previous role was as rapid response matron and leading the telehealth project, which we set up in July last year. So the telehealth service that we currently have in Croydon is integrated in with rapid response team as community emergency 2-hour response team, and this runs 8 AM to 8 PM 7 days a week. Referrals to our telehealth service we've opened up to all health professionals from both community and hospital, so we can support the whole of Croydon. We have dedicated clinicians allocated to do the monitoring of all our patients on the virtual ward. So telehealth is the device as part of our virtual ward in Croydon. We currently have technically 2 virtual wards. We have a COVID virtual ward and we have a non-COVID virtual ward. The current scope of our virtual wards is to help with early supported discharge, so help with the bed flow in the hospital prevention, so to support patients to remain at home within the community, part of medicines management, and part of long-term condition management of complex patients. We have several active pathways within our telehealth virtual wards, such as hypertension pathways, COVID oxygen weaning as part of the early discharge, respiratory, heart failure, many more pathways. I won't name them all. We have select inclusion criteria, it's not suitable for everybody, but it's suitable for quite a lot of people. So anyone who is suitable for home monitoring under the virtual ward, be it COVID or non-COVID, they need to have their own home or care home or sheltered, somewhere where we can use the electricity supply because we need electricity. We also, any patients who are under 18, we can't see, but if you're over 18 and adult, we can have you on our ward. And basically any patients that don't meet the exclusion criteria, which is, there's a few things that we can't help with, unfortunately. So things where people are at high risk of swelling of their upper arms because of where the device sits. I'll talk about the device in just a moment. Thick tattoos can sometimes interfere, but we still like to look at the arms to see if there's a gap in the tattoo where we can work the device, so it's not a complete exclusion. Things like distress or end-of-life care, we don't monitor. And if you live outside our borough, unfortunately, we can't travel out to you. However, if you do live in our borough and don't have a Croydon GP, but therefore you would need to attend our hospital, we would see you at home. And though, as I said, children, we won't monitor children. But overall, you know, if anyone feels that they might have someone suitable for telehealth monitoring, or they feel that they need support at home, it's worth mentioning telehealth to see if the virtual wards can help. There's lots of benefits with telehealth and being on the virtual ward, and that's the point that we have reduced face-to-face contact. That's not to say we don't want to go out and see people. It's just that we want to keep people more safe, but still have full access to them to see and assess them. And we can do that with telehealth because it provides real-time data on the patient that's wearing the device. And it also allows us to video call them and see them. So the benefit is that you're still having contact with a health professional who's managing your care. You have the ability to be cared for in your own home. So that has its benefits in itself, being surrounded by your family, being able to mobilize, eat foods that you like, use your own bathroom, things like that, which is much better, reduce risk of other infections. So there's lots of things. Improved sleep, that's known to help lots of people just getting a good night's sleep. The other benefit I feel is quite important from telehealth is that the team that's monitoring you, should you need to be escalated to a home visit, that's the team that's seeing you. So you don't have to keep repeating yourself. There's benefits for the staff as well, say reduced face-to-face contact for staff, so protection against sort of the risk of COVID. The ratio for staff, we can actually care for more patients with less staff, so that's helping us there. Trend monitoring, we get lovely trend monitoring with telehealth virtual ward patients, because we're not just getting a single oxygen level or a single blood pressure reading, we're getting trends of it so we can see what's happening to that patient. We have access to a virtual multidisciplinary team under the virtual ward, so we have specialist consultants join our MDT to discuss the patients where we need further advice. It builds bridges between services, so between hospital and community, between the ED department and between LAS, so the London Ambulance Service. So I've talked about how the services are running, but I suppose you need to really understand what the actual device is. So it is a remote care delivery platform whereby the device is one on the arm, and I've actually got one on, so I don't know if you can see it, it's a little armband, and that's the device. So it's like a runner's armband. That has the ability to provide us with continuous data of the breathing rate, the oxygen levels, how much the patient's moving. So all of those numbers that we're getting on the patient are correlated to movement as well, because our body changes in response to movement too. There are add-on kits that we use if we need it for certain conditions, so blood pressure and scales. So that can help us as well in the management of the patient. We can see the trajectory of someone's health condition. It's been particularly useful for COVID patients being managed at home. So we have video consultation via the device, so we can talk to patients and visualize them as well as seeing the numbers. There's built-in risk stratification and disease-specific alarms, allowing for us to be able to triage the patient. And the patient can also alert us should they be feeling unwell, because how people feel, we can't always tell. They need to tell us, so we have that option as well. We have the ability to escalate patients to home visits if needed, to outpatient appointments, to other teams, and to ED should we need it. It's all about getting the right care in the right place at the right time for the patient. And that's a big part of what we do. So I will have on the slides, I think will be available at the end, pictures of sort of the device, what's contained in the box. And just so you can get a bit more of a visual idea on it. It's new technology, but it's well received by a lot of patients now, and it's quite easy to use. Just gets shown, and there's not much to it. It's just wearing it really. So our current virtual wards in Croydon are focused on quite an acute service at the moment, and it's been a fantastic support for the community in the hospital. Part of what I'm doing now is I'm just investigating further where virtual wards are going. And over the coming months, I'm going to be looking at ways to more engage with the local community and health professionals to listen and understand what it is more that Croydon needs from virtual wards and telehealth. And I think that's all from me. And if you'd like to know more, obviously, send questions and I'll happily answer. So thank you for your time. And I'm going to hand over now to Michael.
Thank you very much. I'm Michael Burden, Director of HR and OD at the Trust. And as you'll see from the slide, we have over 4,000 amazing staff and volunteers who have gone above and beyond their normal duties to ensure that we've kept patients both safe and well during the COVID-19 pandemic. And it's been really important for us to keep our staff safe and well. It's been always been a priority of this trust, and we will continue to do so. And as part of that process, at the start of the pandemic, we undertook risk assessments of our staff and indeed made them mandatory. And this allowed us to make sure that all people working on site, at home or shielding were in contact with their line managers and their well-being our main focus. Our staff testing team, which is still on site, continue to offer and make sure our colleagues have quick and easy access to PCR testing if required. And I think it's really important to reference that personal protective equipment was ready available to all of our staff. Neither our hospital staff or our community teams ever fell short of supply during the pandemic. During the second wave, we reopened a number of our services, and those staff and colleagues who'd been redeployed were beginning to return to work. And as we've heard previously from Matthew, the way that people began to work was very different to how actually when they'd left work at the beginning of the pandemic. We were able to encourage some of our volunteers to come back as well and become part of Team Croydon again after having ensured that through the risk assessment, it was safe to do so. Could I have the next slide, please? Can I have the next slide, please? Thank you. So some of the actions that we've took in terms of wellbeing was in fact face-to-face and online counselling services, and we have our own mental health first aiders, and I think the numbers as we speak today are nearly 140 mental health first aiders. Our chaplaincy team were also on hand to support our staff, and we made a number of wider NHS facilities available to everyone at the trust. We created wobble rooms and wobble spaces at our hospital and community sites where our staff could take time to relax and reflect. And our kind community also supported staff with a range of donations, from food to a variety of gifts, which were very much appreciated across the trust. And I do know that actually the food was very well received and actually appreciated, because it actually made sure that actually staff did take some time out from the busy work schedules to actually have some refreshment and have some nourishment. And on that basis, I'd like to hand over to Lee now, please, the Chief Operating Officer.
Sorry, folks. Still getting used to unmuting. You'd think by now I could. I'll start again. My name is Lee McPhail. I'm the Trust's Chief Operating Officer. We've heard from colleagues this evening a lot about the challenges that COVID and the pandemic had presented to us in the last 18 months or so. And I'm going to take a little bit of time just to give a quick overview of one of those challenges, and that was recovery. So recovering our health and social care services from wave one of the pandemic. The example that I'm going to give briefly, and then I will hand over to Stella Viggs, our Clinical Director for Surgery, is the development and implementation of what we have come to call the Croydon Elective Centre. And the Elective Centre is really a result of some very committed, passionate clinical and operational leaders in this organisation, recognising that when we were in wave one of the pandemic, that at some point we would have to restart our planned care services. Through that time, early last year, when we had to pause pretty much any activity that we did that wasn't COVID related, as we got into springtime, we did recognise, I think, quite early that, of course, we would have to restart at some point. So with those folks in train, our frontline staff, our IPC team, and as I say, our operational leaders, they put their collective brains together to look at how we could reorganise the hospital site in a way that we could provide planned care services, but in what we call a COVID protected way, so that we would learn the lessons from wave 1 of the pandemic in terms of IPC, use of PPE that Michael's just mentioned, and make the hospital as safe, or that part of the hospital as safe as possible from COVID. We launched the CEC, the Croydon Elective Centre, in early summer last year, and that very quickly became, I think, what by any measure a resounding success. So we effectively cordoned off our theatre complex in the hospital site, similarly with our main surgical ward, and some very, very strict infection prevention controls in place around that area in the hospital, the COVID protected zone. That meant that we were able to see and treat patients surgically, as well as for other things like cardiac care, cancer care and general diagnostics, in a way that meant that we had massively reduced the risk of exposure to COVID. Since we opened last year, we've seen well over 7,000 patients in the Croydon Elective Centre. And indeed, the conversations that I have had, that Stella has had, and others locally and nationally, the Croydon Elective Centre and our COVID protected zone is now recognised right across the NHS as an example of best practice. The creation of the Croydon Elective Zone also meant that as we went into wave 2 of the pandemic, so November, December time, this time last year, although we had to scale back activity, we were able to continue to provide surgical care for patients in Croydon right through that really difficult winter last year. And indeed, the Croydon Elective Centre has continued to go from strength to strength this year, as evidenced by some of the lowest waiting times for surgery, certainly in London, but actually comparatively across the whole of England. Croydon performs incredibly well. It was driven initially by clinicians within the hospital, but I think it's fair to say that actually its ongoing success, and it continues to be a success, has been a result of work right across the Croydon system. So we worked very much in partnership with our GP colleagues and primary care colleagues, our own community services, and indeed regularly with the wider South West London system, to make sure that we had care delivered in as joined up and as quick a way as possible. So on that very quick canter through, I'll hand over to Stella Viggs, our Clinical Director for Surgery, and indeed one of the architects of the Croydon Elective Centre.
Thank you so much, Lee. I just want to go back to the story of how the Croydon Elective Centre was created, because it is a fantastic asset for Croydon. But as Michael has said, the impact of COVID on our staff, you heard from Nadia, the personal stories that sit behind every single individual in this trust. One of the ways of getting our teams back together was actually to try and get back to normal. So a multidisciplinary, multi-speciality team, and I mean every single corner of the hospital, contributed to how can we get our patients treated in Croydon in the way that we would aspire to. So that needed a few principles, and that was that we needed to understand the well-being of our colleagues. Many of our staff were physically and mentally exhausted. We had to listen to patients and carers because they didn't want to come to Croydon. Croydon had been labelled nationally as the COVID hotspot, and we needed to learn from first wave. So through first wave, our main theatre recovery actually became a critical care unit, and we treated patients well, but actually we felt that we could do that in a better way now that we'd experienced COVID in wave 1. And we were asked by the government to put together what we call green pathways, which are pathways in which patients feel safe and can be safe, treated away from the COVID environment. And of course, our main theatres are up on the 2nd floor, and there didn't really seem to be a way to manage that. But the team came together, and the team came together with fantastic ideas. And what we have now done is we have built a new entrance into the hospital, and effectively that hospital within a hospital, that transformation has created 2 distinct sites. The Croydon Elective Centre is a ring-fenced, COVID-protected zone And we have now converted our day surgery unit into the surgical emergency zone, so completely separated out. The Croydon Elective Centre, we've got the cardiac cath lab, as Lee has said. We've got the Dolphin Suite to manage our children in Croydon who need surgical treatment. And we have developed level 1.5 high dependency beds, so we can look after patients who need cancer care or treatment post-operatively that potentially we couldn't manage if our ITU was required for patients who had COVID needs. Doing the work that we've done, we've also improved our surgical emergency flow, and we've got a dedicated emergency centre. And as Leah said, we have treated over 7,000 patients in the elective centre, but in the elective pathway, including our max patients, over 10,000 patients. And this has not just been beneficial for patients in Croydon. We have also benefited patients across South London. And we've just celebrated our first birthday in both the Croydon Elective Centre and the Emergency Surgical Centre, and really proud of the teams as we maintain treating patients of Croydon in the best way that we possibly can. And there have been very positive benefits in our recruitment and retention, in critical care, in theatres, also our well-being and morale. We are doing what we do best, and as surgeons and as theatre staff and people who deliver surgical care, we feel that we now are working smarter, not harder, but also treating our staff in a way that they are now empowered to develop ideas and actually deliver those ideas. And of course, patients are really, really important in this conversation, because the patient engagement and feedback is driving what we are doing. So for example, we now have the Purley Elective Centre where we're delivering local anaesthetics in an environment means that patients can come in, have their operation and go home the same day. And we're also reinforcing our COVID Elective Centre, our Croydon Elective Centre to ensure that we remain resilient through this winter and beyond. So I will stop there, and if I may hand back to Lee. Thank you.
Thank you, Stella. So I am Shubhra Banerjee. I'm the medical director at the Trust and a consultant in the emergency department. And we've heard a lot about what has been a tough year in terms of COVID. And I'd like to really just go back to the end of what was the first wave, because come summer 2020, it was becoming apparent that this virus behaved differently to what were the usual respiratory viruses we were familiar with. And that there were certain patients that were having very prolonged symptoms and illnesses and multi-system issues that weren't improving in the time frame that we were hoping for. And this was picked up by our respiratory physicians and our clinical teams on the floor, who were quick to highlight it and actually started to put together what is now the established long COVID clinic. And we were one of the first trusts in the hospital, one of the first trusts in the country to really start up with this, and took a multidisciplinary approach to managing these patients, probably before there was as much established guidance as there was. And so I'm really quite proud of the team for that. We had to involve multiple specialties. We had input, particularly from our radiology colleagues, who set up separate scanning services for the COVID patients to try and find out if there were underlying medical issues, and then respiratory physician input alongside physiotherapy, occupational therapy, neurology, cardiology, and all the systems that were affected. That's gone on to build as quite a busy service now, actually. As I think about springtime last year, we'd had 1,000 patients through that service. Referrals have continued at quite a rate, and is now long COVID. It is quite a well-known phenomenon. We've had psychology input into patients who have also had mental health sequelae, and it has proven a challenge, but one I'm really quite proud of the team for meeting head on. Next slide, please. This sort of ties into how we took a national approach to vaccination, because once the vaccine was available, Croydon was amongst the first hospitals in the country, and in fact the world, to take delivery of a large amount of vaccines. It was obviously a huge national project, and Croydon rose to the challenge, and we set up a hub within the hospital and started giving out that vaccine, I think 2 or 3 days after delivery. Across the system, it's been a fantastic effort with contributions from the hospital, GPs, community pharmacies, and mass vaccination sites, where we have delivered approaching 500,000 vaccines. Across Southwest London, that you can see that's 2 million, and I think a special mention to George Dyer, who you'll see pictured, who is one of our own volunteers at the hospital and was the first person to be vaccinated by our vaccination team. That work's still ongoing, and in the last few days we have now started going out to local schools to start delivering the vaccine there, as the vaccination program is including children in secondary school. And I just, like Hardia did, need to just re-emphasize that message to people who might be concerned about the vaccine, that really the messaging is, take it if you can, you're protecting yourself and your families. All the data suggests now and shows us that the chances of getting COVID is reduced if you've been double vaccinated, and if you do get it, the chances of becoming significantly unwell, needing intensive care and going on to die is really, really, really down. So just to put that message out there. And as a last bit, Croydon-wide, we are doing, excuse me, a lot of work with community leaders and faith leaders to try and address some of the vaccine hesitancy issues that we have in Croydon. But again, I would point out that Croydon really suffered at the hands of COVID, and our numbers were quite significant. And I would re-emphasize the message, get the vaccine if you haven't already. I will pass you on to Elaine. Thank you.
Thanks, Shub. I'm going to talk to you about some of our quality initiatives. Next slide, please. Last October, we were visited by our CQC colleagues in an unannounced inspection, focusing in particular on our mental health care for patients in our urgent and emergency care services. The CQC findings showed us that we needed to make some improvements. So they recommended a number of improvements, and I'm delighted to say that many of those improvements we have implemented. And most excitingly was the building and now official opening yesterday of our Croydon Mental Health Clinical Assessment Unit, which is run in collaboration with our partners of the South London and Maudsley Trust, which is really improving and will improve the quality of care that patients in a mental health crisis will get while they're being cared for on this site. Next slide, please. We've seen significant improvements in our inpatient survey results. In September of last year, the Care Quality Commission surveyed 434 of our adult inpatients. This is a national survey and it happens every year. And last year we were one of the top 10 improving trusts in the country. So moving in the right direction in terms of feedback from our patients. We know we still have a significant amount of work to do, but really good to see some positive changes in our results, in particular patients' privacy and dignity in the emergency department, much better pain management. Our patients recognised that we had more staff on duty and more nurses to be able to care for them. We also know that we still have work to do in terms of our clear and timely communication with patients and their families, in particular around discharge arrangements, and that we're always and consistent offering kind and compassionate care to our patients. Next slide, please. We're really excited to be part of the HEARD campaign in our maternity services, and HEARD is health equity and racial disparity in maternity services. Black, Asian and minority ethnic pregnant women are up to 5 times more likely to experience poor outcomes. So we're really excited to have been one of the first to start being involved in the HEARD campaign here in Croydon. Every woman will have the opportunity to access a HEARD ambassador, ensuring respectful and equitable access to care for all, but to improve their outcomes for them and their newborn baby. Next slide, please. We've always been have played a significant part in research, but this year more than ever, and we and Croydon Health Services have been involved in some of the high-profile research programs for COVID-19. We have over 200 of our staff involved in the SIREN study, which is a national study, so that scientists can learn more about COVID and antibodies and immunity, as well as some of our ITU patients are involved in a national study, sharing blood samples to help scientists learn more about the virus and best treatments. We continue to do some really good stuff in terms of clinical education, and some of our junior trainees tell us that 6 months in Croydon is worth 3 years of training anywhere else. And that's because of the learning opportunities they get, the pathology of the patients that we treat here, the diversity of our borough, and also the support that we give to our trainees is highly commendable. It's for this that a third of our first year doctors from last year have decided to stay in Croydon to continue their training. And for me, excitingly, we've got 56 student nurses who've just qualified and are about to begin their careers here in Croydon as staff nurses with us over the next month. We're continuing to look at different ways to create career opportunities with different pathways for nursing and physician associates, supporting out all of our teams to deliver safe, compassionate and responsive care. Thank you. I'm handing over to Mr. Sexton.
Thanks, Elaine. Good evening, everybody. My name's Mike Sexton. I'm the Joint Chief Financial Officer across Croydon Health Services in Croydon Borough of South West London CCG. I'm very happy to be reporting to you tonight. As we've heard, 2021 has been a very challenging year for patients and staff. The year has also tested the financial resilience and responsiveness of the organisation to be able to support the front line. And we've had to adapt from moving to sort of immediate support to COVID response, as well as investing in the future through the vaccine programme. In terms of, in April 2020, the normal funding arrangements for the NHS were suspended and simplified so that we could focus on responding to the pandemic. In particular, we had to rapidly request and invest capital in areas such as ventilators, oxygen supply, iPads for patients, laptops for remote working to support the pandemic. We also had to support the supply chain, so our suppliers, through ensuring they were paid promptly and could respond to the pandemic alongside the NHS. And as highlighted here, the vaccination programme that started around December 2020, significant investment running through to the present day and through the coming winter. We go on to the next slide. So in terms of summarising our overall financial performance, which is contained in the annual accounts that we approved at the beginning of the meeting, for the third year in succession, we've achieved a break-even position on our revenue expenditure. Through tight financial control, we were able to both save lives, stay on top of the waiting lists, prevent illness through vaccination, and meet our financial duties. Although our formal financial programme was suspended, which was common across the NHS to allow clinicians to focus on the COVID response, we have nevertheless maintained a strong grip on financial control on pay and non-pay. I would also highlight we met our capital expenditure targets, return on capital targets, and our public sector payment policy, which is how quickly we pay our suppliers. We made a massive improvement from the previous financial year, and we're fully compliant with the 95% target in the final quarter. And to give you assurance, Grant Thornton are our external auditors and have given positive, unqualified opinions on all three areas of our financial statements, and that report is included in the annual accounts pack. If we go on to the next slide. So just a couple of highlights on what we have spent. So highlighting that we spent 382 million on community and acute services in Croydon, and on vaccination services. This is significantly up from the previous year, but reflects a number of factors relating to the pandemic. So a vaccine program, which we were hosting for South West London, significant expenditure on PPE, so protective equipment, also the impact of infection prevention control measures has also increased the level of expenditure we need to incur to protect patients. Just a reminder that around 62% of our expenditure goes on workforce or staffing costs, and also noting that we spend around 15 million on drugs and medication to support patients. If we go on to the next slide, 3 key highlights on our capital program. Starting with the green box, we were able to invest 2.6 million in urgent and emergency care, particularly highlighting the mental health assessment unit, which others have alluded to, but also in ensuring we've got the right bed stock and wards to respond to the demand through A&E and medical need. We've also been investing over the last year in our paediatric integrated unit, and that is due to come online in spring 22. And the third element I would highlight is a recent approval that we've had for our ITU intensive care unit expansion from 15 beds up to 22 beds. So that was a scheme that was approved in August 2021 and will form part of our plans going forward. If I go on to the next slide. For those of you that have joined our AGMs previously or worked closely with us, you will know we are on an integration journey within Croydon, both within the health service, but also with the council and social care. In 2019-20, we pulled together health budgets in Croydon, and in 2021 and this year, we're continuing that journey to try and integrate social care budgets to facilitate joint working and integration of the patient journey and planning for services for the whole population. I go on to the next slide. I just wanted to take the opportunity to highlight the role that our Croydon Health Services Charitable Fund has played, particularly over the COVID pandemic. We have received significant donations from NHS Charities Together, which includes funds raised by Sir Tom Moore, as well as really generous local donations from local residents. And these funds have been deployed mainly into health and wellbeing initiatives to support staff during and recovering from the COVID pandemic. And in terms of looking forward for the fund, we've invested and appointed a new fundraising and grant manager that will really help us make sure the donations and legacies that we receive go quickly to benefit patients and staff in Croydon. We go on to the last slide. Just looking ahead and emerging from the COVID pandemic, there's a renewed focus on productivity and efficiency, whilst completing the vaccine program, recovering the backlog in primary care and on waiting lists, and looking forward managing what is likely to be a difficult winter coming up. But with the approach we've taken through the pandemic and maintaining good control of our resources, I think we're well placed to take on that challenge, which will face all NHS organisations, but I think we're well placed in Croydon to move forward into 22-23. And at that point, I will hand over to Rachel.
Thanks, Mike. I'm Rachel Flagg, Joint Director of Transformation and Commissioning, working across the CCG in Croydon and the Trust. I'm just going to say a few words about how we as a Trust work with others in the local system across health, social care and the voluntary sector. So we're really pioneers of joined up working in Croydon, and our successful partnership takes honest relationships, a shared vision, good governance. So we have partnership forums, joint program boards, and so on. But more importantly, is actually making real change together. One good example of this is the work that the BME Forum and Asian Resource Centre have done with us to reach out to communities who are at risk of long-term conditions, things like diabetes and high blood pressure, making sure that people get early access to the right information and support. Thanks. Next slide. Our Onecoin Alliance is about working across organisational boundaries to improve health and care. So we as a trust work really closely with the council, with the CCG, with the GP Collaborative, with South London and the Maudsley, with Age UK Croydon and others in the wider voluntary sector. And we have other partners around the table like Healthwatch, for example. We also collaborate more widely across South West London, London region and nationally. So we're already putting into place here the ambitions of the integrated care agenda. And through our joint health and care plan for Croydon, we've taken some important strides on our ambitions around tackling health inequalities and bringing care closer to home. Lots changed, as we've heard from many others over the last year. So we've had to adapt to many of our plans, which has slowed progress in some areas, but it's also brought us together like never before. Next slide, please. So we wanted to give an example of some of our Onecoin Alliance work. So integrated community networks is all about joined up working in the community in each of our localities. In June 2020, we started a pilot in the northeast of the borough, and that was really about bringing staff together from different disciplines across health and care to work together side by side and support people with all of their needs, with the outcome of wanting to keep them healthy and independent. And an important part of that has been meeting people's social needs, which of course are so important to well-being. People will be all too aware of the knock-on effects of poverty and poor housing and so on, and the impact that that has on physical and mental health. So what we've done through the talking points is give people easier access to housing support, benefit support, talking therapies and things like exercise and social activities that are out there in the wider voluntary and community sector. And that's worked well in the Thornton Heath area, and we're in the process of developing that way of working across all of our localities. I'll pass back to Matthew.
Thank you, Rachel. We've spent the last 45 minutes or so running through last year, and I'm now going to just briefly, mindful of time, highlight some of the focus for 21-22, the year we're now in. Obviously, COVID hasn't gone away. We know that today, and I thought the reminders from our clinical colleagues, Elaine and Shub and Haida, about the importance of vaccination and indeed maintaining adherence to guidelines on face mask wearing and hand washing, etc., were absolutely well made. We need to continue to do all of that, but we're also now just about to start, or have just started, I should say, the booster programme for health and care workers, those people over 50 and some other at-risk groups. And we were pleased to be the first in the country to start this programme last week. And you can see there an image of Becky Board, who's led our vaccine programme expertly, giving Catherine Cargill, one of our maternity support workers, a vaccine booster on the first day last week. So really positive that we are on the case with that, and we will continue that, as well as, of course, respond to the needs that are identified related to COVID on non-COVID urgent emergency care, as Lee was talking about earlier, and of course continuing to focus on the recovery of the elective pathway and the reduction in waiting times that we are very much at the forefront of. It's going to be a challenging period. One of the ways that we address that is by continuing the work around integration. If the next slide could come across, that'd be great, because that closer integration across Croydon is one of our greatest strengths and a massive opportunity for us. The rest of the country is warming up to the ideas that have been developed in Croydon. That's a good thing to see. We need to carry on in the vein that we have thus far, and we will absolutely do so with our partners from right across the system here in Croydon. One of the things that we'll be doing collectively is being ready for winter. It is going to be a very challenging period, we believe. We think we've made some really good progress on a whole range of issues, as we've highlighted tonight. We know, however, there is much more work for us to do. We are impatient and indeed enthusiastic about the work we need to do to further improve the care we provide to patients, the support we offer to staff. That's going to be tested fully during this winter, and our job is to ensure that we respond appropriately and positively to that challenge with our partners. If we go to the next slide, transforming emergency care is one of the aspects of that. It's something that we talk about and focus on a considerable amount, and rightly so. It impacts on a huge part of our population, and this is a great example of where the place, the whole of the health and care system in Croydon comes together to respond to the needs of our population. This is not something the acute hospital can do on its own, or the acute hospital and our community teams. It's the trust, the CCG, colleagues, primary care, mental health, voluntary sector and local authority together will be able to progress on the agenda of transforming emergency care. So just an example of the sorts of things that we are going to be focused on in this coming year that we are now in. So that ends the presentations, Chairman. I think we're going to go to questions next and then finish with the COVID story. So I will pass back to you, Mike, to let you conclude.
Matthew, thank you so much for that, and thank you to the team as well for a really thorough and I think exciting capture of the year that's just gone. But I think, Matthew, it's really important that you've set out some of our ambitions for the future. We're really proud of what we've done over the last 12 months, but we're not in any way complacent. We know there's a huge amount more that we can and will be doing for the people of Croydon. I'm very happy to take some questions. Please use the box, or please do raise your hand. I'll also depend upon my colleagues in the comms team to alert me via WhatsApp if there's any questions that have come in through social media or other means. I can't at this point see any questions. Comms, are there any questions? We've got one question received, and I think this is very much one for you, Matthew. It's how will we cope with this winter if cases go up again? So I think it'd be very good to say a little bit about the winter planning that's underway. Matthew, over to you.
Yeah, happy to. And Lee is our resident expert on winter planning. He enjoys reminding us of the needs of this regularly, and he's right to do so because it is going to be challenging this year. We have a whole range of initiatives in place already, with more to come. That might well include the development of some extra capacity within the hospital by changing the designation of some areas to increase some capacity, but it's also about looking at the support we can provide out in the community through the community aspects of our work, and also investing in primary care to increase capacity there. That helps us with emergency care, but part of the question I think is how do we respond to COVID, and also how do we ensure we maintain elective services? And we have detailed plans for the continued operation of the elective centre, as Stella and Lee have described. And in terms of COVID, we have a well-developed policy and practice now where we can flex capacity to fit the needs of the population. So the population should be assured that we have an understanding of what is possibly going to be needed and a response to that, and the way that we have been able to respond, I think, positively and successfully throughout the last 18 months or so. But Lee, there might be a couple of points that you want to raise as well.
Thanks, Matthew. Yeah, I mean, I think it's we've been in the midst of winter planning now for months, actually, which they are well-developed plans built up by our clinical directors and their team. So I think, I mean, for the plans that we have on the table, I'm pretty confident they're as good and as responsive as they could be. Couple of other things that I would mention. One thing that we've tried to do as part of winter planning this year, rather than just focus on, you know, what's coming through the front door, volumes, etc. We've tried to incorporate a little bit about what Michael told us on staff health and well-being, recognizing how difficult the winter is going to be. So we've got some explicit things in our winter plans this year about how we look after each other and how we look after our wider teams. Other bits, again, you referenced it, Matthew, that we're trying to focus on not just the sort of the walls of the hospital. So the presentation we heard from Francesca on telehealth, telemedicine, and how do we maximise that. Keeping patients safe and well in their own home environment is really important. And then that bit about the elective centre. So recognising that we, although at Croydon or perhaps as challenged as other organisations, we still have a backlog from the pandemic that we need to deal with. And Stella touched on it, that we're now reconfiguring the hospital site for what feels like the 500th time, just to make sure that we have got adequate protected bed capacity for surgical and planned care patients. And that work starts next week and will be completed before we get into the depth of winter. So it is a whole range of things. It's both acute, community, through Rachel and her team, we're linking that up with the plans in primary care. So we're trying to take a system approach to winter this time.
Lee, whilst I've got you here, I've got another question which I think that you'll be able to reassure people of, and it's in relation to the new critical care unit. People are interested to know when that will be open. They're also anxious that the opening of that might result in the closure of the ITU whilst the building work goes on. So a little bit about the critical care unit and the plans there would be great.
Yeah, sure. I mean, again, through the presentations we've done this evening, a real success story for Croydon. We had secured that resource before the pandemic hit, and boy, one of the lessons from, well, many lessons from the pandemic is how absolutely important and vital our critical care services are. So the work starts on the critical care units in about a month's time. I think we start the pre-work sort of late October, beginning of November. It's Stella will keep me right here, 24-26 month program of work. And it doesn't just affect our critical care services. So we're having to relocate a number of services across the trust as a result. And that increase in the bed capacity and the quality of the facility that we have, from the sort of 15 beds that we have at the minute up to 22-23 beds. The ITU will not close through that work. So there's a sequence of building works that will be quite complicated. I'm sure Stella and I could bore everybody on this probably for the rest of the night, because it feels like we've been talking about it for a long time. But clearly, as a major acute hospital, we couldn't function without our ITU. So it will be a bit disruptive. It will move services. ITU will be reconfigured a number of times while we do the building work. But that is a very, very detailed plan that we've built up as part of the program board that Stella, some of our critical care team have led. So we've got a very detailed step-by-step plan. The infamous Gantt chart is in place and being socialised in the organisation at the minute, so that everybody is familiar with what will happen when. But I can say with absolute certainty our ITU will not close while that work is underway.
I think that's incredibly good to hear, and it is exciting that we've got new builds going on in the hospital, but equally we heard from Francesca about the work we're doing to make sure that people can be cared for in the community, and our work with our partners is absolutely vital. I've got one more question which has come in, and I'm not sure which one of you I want to put it to. And that question is, who will win the Trust of the Year? And I guess I'm going to answer it because I know that all of my exec colleagues are far too modest. I can't give you the answer to who will win because my crystal ball's a bit cloudy today, but I can tell you who should win, and that's Team Croydon. So thank you all very, very much for your questions today. And colleagues, thank you so much for your presentation. Board colleagues, thank you so much for your presentation. Stella, Francesca, thank you for sharing the innovations of your team. Hadia, thank you so much for sharing your story. I was so moved to hear it, and it just says something about the struggles that all of our staff have, because you're not only nurses, doctors, or other important workers here, you're also people that have families, lives, and we need to make sure that we constantly keep that at the front of our minds. So thank you all for that today. We're going to finish the formal AGM at this point, but we are going to show you a brief, but I think a really important and powerful film called Our COVID Story. And it gives you a whole host of stories about how Team Croydon rose to what could be called the greatest healthcare challenge, either of this generation or of the last century. And I think that we can be enormously proud. So I'm going to ask comms to put the video on, and thank you all once again for joining us this evening. And a big, big thank you to our partners, but most of all to our staff at Team Croydon. And we look forward to being back next year, celebrating another fantastic year of progress and delivery for our community in Croydon.
The beginning was scary. We knew there is a virus, possibly deadly virus, hoping that it's not going to come over here to UK, but it did.
Everyone was a bit scared. We had to take on a workload that we didn't really know much about, so we had to top up our skills. It's like, I don't even know how to explain it. It's on-the-duty learning, so it's been very tough.
I was asked to shield because of my medical conditions. Although the shielding was meant to protect me, but I felt like I'm letting down my trust, I'm letting down my colleagues. But I'm so happy, I'm so proud of them.
The sadness, the exhaustion, the pace of how the wave was coming, and the numbers, and I say numbers, they're people, there were people, real patients with really sad stories coming in. That was really, really difficult.
I mean, it's been unremittingly hard work for the staff. People have gone not just an extra mile, but, you know, extra hundreds of miles.
There were times that the stress, kick in, and you have to go back to the bathroom and cry and clean your face and come back to work. But I love my job. I love what I do, and I'm very passionate. And I think that is what keeps me, going.
What Croydon does well is when there's a crisis, we come together as a family, and amazing things happen. And it was the same at this point in time.
What's kept me going throughout this whole last 10 months, I'd say, is the team. The team that I work with are absolutely amazing. I think they are the reason I stay in the job that I do.
The vaccine is a light at the end of the tunnel, definitely.
We were really excited in Croydon to be one of the first vaccine centres.
I think that we'll continue to be a fantastic service that is offered in Croydon, and that we will support each other, and that we will keep going.